Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
Welcome to Health Watch, presented by UMass Memorial Healthcare. Today we're talking about osteoporosis, a disease that weakens the bones.
So osteoporosis is porous bones or a thinning of the bones. Most commonly occurs with aging. The bones do naturally become thinner with age, and that puts us at risk for having fractures as we get older, the most dangerous of which would be hip fractures and spine fractures that can really be very debilitating.
Who is at risk for osteoporosis?
Age is probably the biggest risk factor. As people get older, it is expected that the bones do get weaker. There are other risk factors. If you've had fractures already, you're more likely to have more fractures and a low bone density. If you are very thin and have lower muscle mass, you're more likely to have a low bone density and fractures. Family history, if your mother or father has had a hip fracture especially, that puts you at increased risk. Almost any disease that affects the whole body affects the bones, and so whether it's diabetes or cancer or people have had heart attacks or strokes, there have been all kinds of connections made with those diseases and weaker bones.
How important is calcium?
Calcium is one of the main components. It's the mineral component of the bone. And so it is very important that we get enough calcium throughout our lives, starting when we're building our bones from a very young age into our adulthood. And then if we're deficient in calcium, it can speed up the bone loss that happens as we get older. So we generally want to avoid being deficient in calcium.
How can vitamin D help?
One of the main functions of vitamin D is to help the body absorb calcium from the intestine. So first of all, you have to have enough calcium coming in for vitamin D to be effective. And then if you don't have enough vitamin D, you won't absorb as much calcium, so the two really work hand in hand. For the general population, it's recommended that we get at least 1,000 milligrams of calcium, whether it's from diet, which most commonly comes in the form of dairy. And some green vegetables can have some calcium as well. They're usually lower amounts than dairy. And then if you don't get enough dairy in your diet, some people don't tolerate dairy very well, and you usually need 3 or 4 portions of dairy a day to get enough calcium. Most people don't get that much, which is why a lot of times we recommend supplements. And then with the vitamin D, if you're getting that 1,000 to 1,200 milligrams of calcium a day, then people need some supplementation to keep their vitamin D levels healthy in the blood, especially if they have osteoporosis. We want to keep those levels a little higher, and that usually requires supplements for most people, although some people can have healthy vitamin D levels even without supplements, so that really depends on having it tested.
How important is exercise in preventing osteoporosis?
Having less muscle mass is one of the risk factors. So just being active and being healthy will help keep the bones strong. Now, there are 2 components to that in terms of preventing fractures as well. Because on one hand, there are exercises that actually help the bones directly. Those are called weight-bearing exercises. People usually think of that in terms of lifting weights, but actually it's more about your body's impact on the ground and gravity. So for instance, walking is one of the best exercises that we recommend. If you can go for a walk for 30 minutes, 3 or 4 times a week, that really is good for the bones. And then any exercises that keep balance, like Pilates and yoga and things that people do, that doesn't have the impact, may not help the bones directly, but if it helps balance and prevents falls, well, that's a wonderful thing for bones as well.
How does muscle strength affect bones? People
who have less muscle mass tend to have weaker bones, and there's all kinds of interplay on a cellular level. And so just keeping your muscle mass stronger is also likely to help the bones stay stronger as well.
What about medications?
There are an array of different medications. So this is on top of people who are getting a healthy amount of calcium, good vitamin D, and being active. But still, as we get older, the bones do tend to get weaker, and there is an increasing risk of having dangerous fractures as we get older. So we do have medications that can have benefits above and beyond just good calcium, vitamin D, and exercise. And the medications come in different families. They work different ways. They have each ones have their own risks and benefits. There's been a lot of scary information over the last 10 years or so about some of the medications, but if they are used in a sensible way, where we can try and get the benefits of the medications but minimize some of the risks by using them in a sensible way, then really we can try and alter Mother Nature's intention, which is to have weaker bones as we get older. We can try and modify that risk and yet still use them in a way where we minimize the risks of the medications.
If someone is concerned about osteoporosis, what should they do?
It is recommended that women over 65 and men over 70 do get a bone density test, which is one method of assessing the strength or the density of the bones. And even before that, if people are concerned because of a family history, they can be screened earlier. And most primary care doctors will feel very comfortable, you know, who they would recommend maybe doing earlier screening or getting screening at the appropriate time. And certainly if someone is found to have a low bone density, again, speaking with their doctor to make sure they're getting healthy calcium, vitamin D, exercise, and whether or not their risk would warrant any additional help beyond that with the medications that we mentioned.
Are there any symptoms?
The osteoporosis is an asymptomatic problem, and I equate this to heart disease, where people can have blocked arteries in their heart, but they've never had chest pain until, God forbid, someday there's a big heart attack. Osteoporosis is the same way. It is completely asymptomatic. It does not cause pain. It's just that the bones are naturally getting weaker as we get older, and so it's this problem that nobody would know they would have until, God forbid, they have a fracture.
Is osteoporosis curable?
The bone density can improve, especially with some of the prescription medications that we provide. But when the bone density improves, it can improve in different ways. So sometimes the medicines preserve the old bone, but it can still become denser with calcium. So you get denser old bone and the bone density increases. Whether or not you can consider that resolution of osteoporosis, if you were borderline and now you're just within, you know, in the better range, doesn't necessarily mean the osteoporosis is gone as much as you've just improved the density of the bones. And on the other hand, there are also medications that stimulate new bone growth. And those have their own risks and benefits that maybe you could look at that as building new bone and reversing it to some degree, but it's really debatable whether you could look at this as curing the osteoporosis versus just modifying the risk that we've accumulated over our lifetime.